Committee of the day is Health and Human Services. The first item before us is approval of the previous meeting minutes. Is there a motion to approve?
Move approval.
Second.
It's been moved and seconded. Any discussion? Seeing none, all in favor, please say aye.
Aye.
Aye. All opposed, say no. Motion prevails. We have 3 routine items and 1 item for discussion. The usual and customary contracts and amendments to contracts is before us. And we have a couple of items that our staff would like to talk to us about before we do this. So, Mr. Holzmer or Mr.
Madam Chair, Commissioners, I just wanted to highlight a couple of contract areas in the report. First of all, there's 19 contracts with our employment service providers in this contract report. As you may recall, we spent a good deal of time last year meeting with all of those providers and that network of employment service providers to discuss approaches for how we could better align their work with our new regional approaches. So as a result of that, as you know, because we've met with each of you individually to talk about it, we issued 2 RFPs, and we are moving forward with a regional model for employment services in our 3 suburban hub areas, and our traditional model in the urban area of Minneapolis at this point. What we're going to be able to do, I think, in moving ahead with both models is to see how well the new regional model works. What we're attempting to do is to make sure that as people come into those regions for services, they can be immediately linked with an employment service provider in the regional model, because those employment service providers will actually be on site, whereas that's not been the case with the traditional model. So if that works as well as we hope it will, we'll probably move to a full regional model at some point in the future. But this gives us a chance to work with both the regional model and the traditional model and see what kind of outcomes we get in terms of how those services are structured. So the other area that I wanted to highlight was that there is a contract for the ALC Plus program with District 287. If it would be okay with you, Madam Chair, I would ask Jamie Halpern to come up and just for a couple minutes kind of outline that particular contract and some of the changes that are going on there to improve and actually add additional slots for students under that program in Minneapolis.
Mr. Halpern.
Thank you, Madam Chair. Commissioners, Jamie Halpern, Human Services and Public Health Department. One of the items in the contract report is with Intermediate School District 287 for $562,000 for the ALC Plus program. This is the first of 2 contracts you will see. There'll be a second contract coming before you in July with the Minneapolis School District. The ALC Plus program is a partnership with Intermediate District 287, Minneapolis, and Hennepin County. And in Hennepin County, the Human Services Department, Department of Community Corrections, and our County Attorney's Be at School initiative to assist county-involved youth return to school and graduate. The program was first developed in 2008, modified in 2010. It was an alternative to Hennepin County-funded structured day programs for juveniles who are absent for school. The previous programs were costing Hennepin County over $3 million a year in property tax funds. The ALC Plus program is designed to provide supports for county-involved youth, youth in juvenile probation, children in foster care and the mental health system, children who are excessively truant, kids who have prior histories of poor school attendance, or who are returning to school from out-of-home placement. The recent cohort study that we commissioned as part of our AGRAD initiative noted that county-involved youth have poor school outcomes. 50% of the students we studied in the cohort study weren't in school at all. If they were in school, we saw the significant declines in their attendance starting in 9th grade. They made frequent school changes. They had poor performance on standardized testing and extremely low graduation rates, 30% overall, 25% graduation rates for kids in the juvenile correction system. We've been operating the current ALC Plus program for the past 4 years, and we have evidence that county-involved youth can be successfully re-engaged in school. In the past 4 years, 263 students have been enrolled in the 2 ALC Plus sites that are operated by Intermediate District 287, the North Education Center in New Hope and the South Education Center in Richfield. And we have seen in this program an increase in school attendance for the students enrolled. Prior to ALC Plus, none of the children attended school at the 80% level, and 16% of them weren't in school at all. Once enrolled in ALC Plus, 25% of the kids had 80% attendance or better, and of these, 13% of the children enrolled had over 90% school attendance. We've seen students graduate. We've had 21 graduates to date and 5 students achieving their GED certificate, 10% of the kids that were enrolled in the program so far. And that the youth in the program are staying in school. 30% of them have been involved in the school for at least 1 year or more. Only 11% of the students dropped out, which may not sound like a good number, but for this population of students, it's a very good number. And the remainder of the children are still enrolled in the ALC Plus program or have transferred back to their home school or a more intensive school setting like a special education setting, which ALC Plus is not. Contract today is part of our plan to recommend the program moves ahead. We're reducing our overall county spending on the program to $900,000 annually. Last year it was $1 million, and we're doing this by focusing the county money on the wraparound services that have proven effective and by not funding some of the educational supports that we funded when we started the program. Remember this, we used to spend $3 million a year of county funds on this population. We're expanding the program by over 40%. We're growing it from 80 students to 115 students, and we'll be opening the program in 3 new Minneapolis public school sites for new Minneapolis referrals. 2 of the sites will be high-performing contract alternative schools, PYC and Menlo Park. The 3rd school is still being selected. It was initially intended to go to Edison Public School, but recent changes taking place in the school necessitated we look for a new site, and that site will be confirmed before the Minneapolis contract is brought before you in July. We're dividing the funds, the $900,000, into 2 contracts. The first one is before you today. The next one will be in July. Today's contract is with Intermediate District 287. It will serve 55 students, 40 of whom are suburban students. 15 are Minneapolis public school students who want to remain enrolled in the school program and continue their education at those sites. And then in July, we'll have a contract to bring forward with the Minneapolis Public School District for 60 students at their 3 new sites. Any questions?
Thank you. Any questions? Commissioner McLaughlin.
Well, Madam Chair, thank you. I appreciate that report. I think where it's showing kind of what we're trying to do with young people. This is a difficult population. We've had our report about the graduation rates, and I think this is a good step forward. I think our approach is evolving, and I appreciate the good work you're doing with both 287 and the Minneapolis School. Thank you.
And I appreciate that you're able to focus the funding, reduce the amount we're going to spend, but expand the number of students that we'll be able to help by doing that focusing. So I think that's good. Any other questions? So we need a motion to approve this item and all the other contracts and amendments to contracts.
Move approval.
Commissioner Green moves and
Second.
Commissioner McLaughlin seconds. Any discussion? Seeing none, all in favor, please say aye.
Aye.
Aye. All opposed, say no. Motion prevails. Thank you. The next item is an amendment to an agreement with GE Healthcare for the purchase of software support services for Metropolitan Health Plan, extending the term through the end of January 2015 and increasing the not to exceed by $225,000. It's been moved, and did I hear a second? Yes. I did. All right. Any discussion? Seeing none, all in favor, please say aye.
Aye.
All opposed, say no. Motion prevails. The third routine item is an amendment to an agreement with the Department of Human Services accepting an MFIP Innovations grant for the evaluation of Health Choices Child Wellbeing Pilot Program.
Second.
Moved in and seconded. Try and say that twice in one sentence. That's difficult. Any discussion on this item? Seeing none. All in favor of adopting this item, please say aye.
Aye.
All opposed, say no. Motion prevails. The last item is an amendment to an agreement with the Department of Health to implement the statewide health improvement program, increasing the amount of money we get. Is there a motion to approve this?
Approve.
It's been moved. I'll second that. Any discussion? Anybody want any more information on this? I guess not. All in favor of approving this item, please say aye.
Aye.
All opposed, say no. Motion prevails. And before we adjourn, we're going to have I think, photos and presentation about our excitement from last Saturday. Many of us were part of the Green Line opening, and we'll today we'll say it was a health item. So I'll move that. I'll turn it over to Commissioner McLaughlin.
Thank you. I was remiss in my committee, and I thank you, Madam Chair, for letting me put this on as a health and wellness item here today. We did open the Green Line on Saturday, formerly called the Central Corridor. There were a whole heck of a lot of people who took advantage of it, even on a rainy day. There were celebrations along the line at various stops, including the Union Depot and Target Field Station. And we had, as you can see, big crowds who were waiting to get on the train and get off the train. The Green Line really reconnects the Twin Cities. It really reinforces this connection between Minneapolis and St. Paul. It builds on the Hiawatha Corridor, now the Blue Line. There's Congressman Ellison and Chair OPAT. It really now we're creating a system within the region. And it's going to help us to maintain our economic competitiveness in the metropolitan area by providing a high-quality transportation option. That was on the train. That's Councilmember Quincy, as well as our senior senator, U.S. Senator Klobuchar, who participated in the ceremonies at the Union Depot, as well as Chair OPAD, who was there, and this was on the first train ride. And there's Commissioner Higgins, who spoke at Target Field Station and was there along with Commissioner Green. We had the celebration there, and as well as 9 other stations along the line. So that's probably as big a picture as you'll ever see of yourself, Commissioner Higgins. But it was a grand day. There's the ribbon cutting at Target Field Station, the facility that we helped to put together. And all in all, it was a good day, a little wet, but some people were properly dressed, it appears, and that was important on that day. But now it's up for regular operations today, and it's going to continue to be a service here within the metropolitan area. So thank you, Madam Chair, for letting me make that presentation.
And we had a great time at the Target Field Station opening. We actually had some Metro Transit employees who sang, and they were called the Clocked Headways, and it was a lot of fun, and we had several of the downtown business people who spoke, Dave St. Peter from the Twins, and we all had a great time, got on the train, and made our way east to the capital city. So I encourage anybody to go see the line, ride the line, and enjoy this investment on behalf of all the residents that we serve. And I don't believe there's any more business before the Health and Human Services Committee, so we are adjourned.